First aid and post-incident management. Introduction to the module. In any workplace, the ability to respond swiftly and effectively to accidents can make all the difference between a minor injury and a life-altering event. First aid and post-incident management are not just about treating injuries, they're about creating a culture of care, safety and preparedness. Without proper first aid procedures and incident management, what starts as a small mishap can escalate into a major problem, affecting both employees and the organization. This module covers essential aspects such as workplace first aid, legal requirements, managing injuries, and post-incident procedures. You will learn how to assess first aid needs, appoint first aiders, conduct investigations, and prevent future incidents. Learning objectives. By the end of this module, you should be able to assess workplace first aid needs and requirements, understand the legal obligations for first aid in the workplace, know how to manage work-related injuries and diseases effectively, apply root cause analysis to investigate workplace incidents, update risk assessments and procedures based on lessons learned. Essentials of workplace first aid. Workplace first aid ensures the safety and well-being of employees, as well as complying with health and safety regulations. The Health and Safety Executive, HSE, mandates that employers provide adequate first aid provisions to their staff. Here are the essential elements of workplace first aid. First aid needs. Assessment. Employers are required to assess the first aid needs of their workplace. This assessment helps determine the number and type of first aiders needed. The assessment considers factors such as the size of the workforce, the type of work and associated risks, the location of the workplace. For example, remote areas may need more comprehensive first aid provisions, the history of accidents or medical conditions in the workplace. Appointing first aiders. Based on the first aid needs assessment, employers must appoint a sufficient number of trained first aiders. There are different levels of first aid training. First aid at work, FAW. A comprehensive 3-day course covering a wide range of emergency situations. First aiders trained at this level can provide help in more serious situations, including heart attacks, fractures, and burns. Emergency First Aid at Work, EFAW. A shorter 1-day course, ideal for workplaces with lower risk, where employees can provide basic care in case of minor injuries or illnesses. Pediatric First Aid. Specific training for workplaces involving children, such as schools or childcare centres. First aid kits. Employers must provide an appropriately stocked first aid kit that is easily accessible to all employees. The contents of the kit should be determined based on the needs assessment and should include, at a minimum, plasters, bandages, and sterile dressings, antiseptic wipes and creams, scissors and tweezers, medical gloves, a first aid manual, burns dressings and eye wash solutions, resuscitation face shields or masks. First aid training and refresher courses. First aiders must undergo initial training and periodic refresher courses to ensure they remain up to date with the latest techniques and procedures. HSE recommends that first aiders refresh their skills every 3 years. Training should cover tech following: basic life support, for example CPR, treatment of common injuries, for example cuts, burns, sprains, managing medical emergencies, for example heart attacks, strokes, seizures, how to safely move injured individuals, recognizing signs of illness, and seeking medical help when needed. Record keeping and procedures. Employers should maintain a record of all first aid incidents and treatments administered in the workplace. This helps track common injuries or health issues, ensures compliance with reporting regulations, and supports continuous improvement of first aid provisions. Alongside record keeping, Clear procedures must be established for reporting accidents or medical emergencies. Employees should know who the designated first aiders are, how to contact them, and where the first aid kits are located. Moreover, all employees must be aware of emergency exits, fire evacuation plans, and other safety protocols to ensure a coordinated response in critical situations. Legal requirements for first aid at work. In the UK, legal requirements for first aid at work are governed by the Health and Safety First Aid Regulations 1981. These regulations mandate that employers provide adequate and appropriate first aid provisions to ensure immediate help for employees in case of illness or injury at work. Employers must comply with their duty of care by conducting a first aid needs assessment to determine the level of risk and ensure sufficient provision of trained personnel, equipment and facilities. Factors such as workforce size, workplace hazards, and proximity to emergency services must be considered. The regulations require employers to ensure that first aiders are appropriately trained and hold certifications from a recognized provider. Training must be refreshed every 3 years, and employers must maintain compliance by updating provisions in line with workplace changes. Under the Health and Safety at Work Act 1974, employers who fail to meet these obligations may face legal action, including fines and prosecution. Additionally, the reporting of injuries, diseases, and dangerous occurrences, Regulations 2013, RIDA, requires reporting serious injuries, illnesses, or incidents to the Health and Safety Executive, HSE. Adhering to these legal requirements protects both employees and employers, ensuring compliance with UK workplace safety laws. Managing work-related injuries and diseases. Work-related injuries and diseases can have severe consequences for employees and businesses, making their effective management a legal and moral imperative. Under the Health and Safety at Work Act 1974, UK employers are required to implement measures that prevent workplace harm, respond effectively to incidents, and support affected workers. Below are some of the key considerations that should be addressed. Prevention. Employers must implement risk assessments to identify workplace hazards and take proactive measures to minimize risks. This includes providing training, protective equipment, and safe working practices to reduce the likelihood of injuries or occupational diseases. Immediate response. In the event of a work-related injury, immediate first aid should be administered by trained personnel. Employers must ensure appropriate first aid facilities are available and that injured employees receive medical attention promptly. Reporting and record keeping. Under the reporting of injuries, diseases, and dangerous occurrences, Regulations 2013, RIDA, employers must report serious injuries, diseases, and dangerous occurrences to the Health and Safety Executive, HSE. Accurate records help identify trends and prevent recurrence. Rehabilitation and return to work. Employers should support employees in their recovery through tailored rehabilitation plans. Gradual reintegration, modified duties, or adjustments can help employees resume work safely and productively. Legal compliance. Failure to manage work-related injuries and diseases can result in fines, legal action, and reputational damage. Compliance with health and safety regulations is a must to safeguard workers and avoid liability. Post-incident investigation and prevention. After any work-related injury or illness, it is essential to promptly report the incident, sometimes in accordance with the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations, RIDA, and ensure that detailed documentation is maintained. Reporting not only ensures legal compliance, but also provides a valuable record for future reference. Thorough documentation is key to recognizing patterns, enhancing safety protocols, and preventing the recurrence of similar incidents. In addition to reporting, employers must take further steps to investigate the incident thoroughly and prevent future occurrences. The following are the essential steps to take in post-incident investigation and prevention. Root cause analysis. Root cause analysis, RCA, is a systematic method used to identify the underlying factors contributing to an incident. Instead of merely addressing the symptoms, RCA seeks to uncover the primary cause of the issue, so these can be addressed directly. Key steps in RCA include data collection, gathering facts including witness statements, incident reports, and physical evidence from the site. Analysis tools, using techniques such as the 5 whys or fishbone diagrams to trace the root cause of the incident. Identifying contributing factors. This may include inadequate training, faulty equipment, communication breakdowns, or lapses in safety procedures. Communicating lessons learned. Once the root cause is identified, it is essential to communicate the findings to all relevant stakeholders, including employees, management, and safety personnel. This is crucial for raising awareness, ensuring that the lessons learned from the incident are shared widely within the organization. Promoting a safety culture, fostering an environment where employees feel comfortable discussing safety concerns and suggestions for improvement. Preventing repetition. Sharing insights from the investigation helps ensure similar mistakes are not repeated, reinforcing the importance of adhering to safety standards. Updating risk assessments and procedures. After analysing the incident, employers must update risk assessments and safety procedures to address any gaps or shortcomings. This might include revising risk assessments. Based on the new findings, existing risk assessments should be updated to reflect newly identified hazards or more accurate risk levels. Improving safety protocols, modifying or introducing new safety procedures, guidelines, and emergency responses to reduce future risks. Training and awareness. Updating training programs and materials to reflect any changes in procedures and ensuring all employees are made aware of the updated protocols. Ongoing review, establishing a routine process for reviewing and revising safety measures to ensure they remain effective over time. Highlights from the module. Workplace first aid ensures the safety and well-being of employees, as well as complying with health and safety regulations. Employers should maintain a record of all first aid incidents and treatments administered in the workplace. In the UK, legal requirements for first aid at work are governed by the Health and Safety First Aid Regulations, 1981. Employers must implement risk assessments to identify workplace hazards and take proactive measures to minimize risks. Root cause analysis, RCA, is a systematic method used to identify the underlying factors contributing to an incident. Thank you. You have successfully made it to the end of this module.